Hello, so today I'll be talking about health disparities and inequities and why they are such a big issue here in the United States and some of the initiatives that have been implemented and taken place in order to solve the problem. So, why are health disparities and health inequities an issue? Well, with health disparities, they not only affect the groups facing disparities, but also limit the overall improvements in quality of the care and the health for the broader population, which can lead to eventually unnecessary costs. For example, in the United States, since the population is becoming more diverse, the number of colored people to account for will rapidly increase over the years. It is expected that people of color will take for over half of the population in 2045. And through this image here, you can depict that in 2045 there will be a 13% increase in the population of different colored people, making them 51% of the population. Due to this rapid increase, it is very important now that we resolve these health issues. So today, many groups face significant disparities in access to and utilization of care. People of color generally face more access barriers and utilize less care than whites. For example, among non-elderly adults, Hispanics, Blacks, American Indians are more likely than whites to delay or go without needed care. Additionally, some groups have high rates of certain health conditions and experience poor health outcomes. Blacks and American Indians have far worse than whites on many measures of health status and health outcomes. For example, with non-elderly adults, Blacks and American Indians have a higher prevalence of asthma, diabetes, and cardiovascular disease. With this comparison of races here, you can obviously see how many different ethnicities have been suffering from asthma and heart diseases. However, the percentage is very low when it comes to actually visiting the doctor and being diagnosed. Not only that, but with the percentage of people, not only that, but also health disparities are also striking in the burden of AIDS and HIV diagnoses, with Blacks experiencing over 8 and 10 times higher rates of HIV and AIDS than whites. So there have been a few key initiatives that have been implemented that over the past few years, which involve the Minority Health and Health Disparities Research and Education Act of 2000, the works of the Department of Health and Human Services, along with the state and local communities, private organizations, and other providers that contribute to fixing the health disparities and equities that we have here in the United States. So, over a decade ago, there has been recognitions of health and healthcare disparities through reports in the major legislations focused on the reduction of the disparities. So, in the early 2000s, there were two Surgeon General reports on the topic of tobacco use and the access to mental health services based on race and ethnicity. And the first major legislation focused on the reduction of disparities, the Minority Health and Health Disparities Research and Education Act of 2000, created the National Center for Minority Health and Health Disparities and authorized the Agency for Healthcare Research and Quality to regularly measure progress on the reduction of these disparities. So not only that, but also in 2011, the Department of Health and Human Services developed an action plan for eliminating racial and ethnic health disparities. The HHS Disparities Action Plan sets out a series of priorities, strategies, actions, and goals to achieve its vision of a nation free of disparities in health and healthcare. Since the release of the report, HHS has undertaken various efforts to implement the Disparities Action Plan, which include coordinating programmatic and policy efforts to advance health equity, expanding access and quality of coverage and care, and strengthening the healthcare infrastructure and workforce. So, and also in 2013, the Health and Human Services also updated the National Standards for Culturally and Linguistically Appropriate Services, also known as CLAS, which seek to ensure that people receive care in culturally and linguistically appropriate manner. So, with states, local communities, private organizations, and other providers, they are also engaged in efforts to reduce health disparities. Through racial and ethnic approaches to community health, grants funded by the Centers for Disease Control and Prevention, a number of states, local health departments, universities, and nonprofit groups implemented community focused interventions to reduce specific neighborhood based disparities. These interventions vary in scope and focus on outreach, cultural competency training, and education. Private foundations have also developed significant initiatives aimed at reducing disparities, and providers are increasingly undertaking disparities focused efforts.